health is vital to a nation's competitiveness. At the forefront of bringing health to everyone in Taiwan is the Bureau of Health Promotion. The Bureau was established on July 12, 2001 by merging a central government agency and 3 former research units. A decade later, former Directors General Wang Ruiheng, Lin Shoujue, Wu Junming, and Xiao Meiling had laid a solid foundation for health promotion. Now, under the leadership of Qiu Shuti, we see even greater support for healthy lifestyles and health policies.
国民健康局提供从子宫到天堂，涵盖男女老幼的全面的健康促进服务，包括妇幼卫生、慢性病防治、癌症、肥胖防治，还有烟害防治，以及呢健康监测各方面都有非常好的绩效。
The primary mission of the Bureau of Health Promotion is to strengthen the healthcare system. The Bureau is committed to creating an environment where health is available to all, especially groups with special needs. This includes children, teenagers, and pregnant women. One of the Bureau's achievements is creating baby-friendly hospitals. Hospitals certified as baby-friendly increased from 38 in 2001 to 158 in 2011, covering almost 71.4% of births. The rate of breastfeeding at least 1 month after delivery rose from 33.2% in 2004 to 61.8% in 2011. Subsidies are provided for high-risk pregnant women and newborns to receive prenatal hereditary diagnosis and hereditary metabolic disorder screening. By 2012, there were 45 centers dedicated to assessing child development. They provide full coverage for newborn auditory screening and Group B streptococcus screening among pregnant women. Eliminating gender bias is another area where significant progress is occurring. Taiwan moved down to 12th in the world for gender bias, the lowest in 16 years. These data suggest close to 1,000 female infants were rescued, showing the success of the Bureau's Saving Female Babies campaign. The Bureau of Health Promotion encourages healthy lifestyles and behavior. People are urged to quit smoking and betel nut chewing, and they are constantly reminded to take care of their eyesight, hearing, and oral health. To prevent obesity and chronic diseases, the Bureau advocates a healthy diet and regular exercise. Among the Bureau's accomplishments on these fronts, one stands out. The smoking population among adults was reduced by 420,000 compared with 2008. This is largely due to enforcement of a new amendment to the Tobacco Hazards Prevention Act enacted in 2009. New regulations reduced exposure to secondhand smoke in indoor public areas by 75%. Most people were pleased with such results, with 90% of people in Taiwan expressed approval in a mere 1 month after amendment took place. The year 2011 was the 100th anniversary of the founding of Republic of China. To commemorate the occasion, the central government and local health authorities took time to battle obesity by launching the Healthy Centenary Healthy Taiwan campaign. President Ma Ying-jeou acted as the spokesperson, encouraging the public to eat smartly, exercise happily, and weigh every day. By the end of that year, a total of 720,000 people lost more than 1,100 metric tons of excessive body weights. Building a healthy and supportive environment is the key to universal health. Over the past several years, the Bureau has encouraged health-promoting schools, workplaces, hospitals, communities, and cities. Its Healthy Workplaces push led the 2011 smoking rate in workplaces to drop to just 16.9%. One of the WHO's campaigns is the push for healthy cities. The Bureau answered this call by helping local counties and cities to achieve the needed targets. In 2011, 7 Taiwanese cities and 11 areas were admitted to join the Alliance for Healthy Cities as non-governmental members. 19 communities received WHO certification as international safe communities. Not to be outdone were hospitals. 76 received WHO certification as health promoting hospitals, or HPHs. There are more members in Taiwan's HPH network than any other national network in the world. And Taiwan has presented the highest number of research papers in the annual HPH International Conference for 3 consecutive years. The Bureau of Health Promotion co-hosted the 20th International Conference of HPH in conjunction with the WHO Collaborating Center for Health Promotion in Hospitals and Healthcare. It was the first time the conference was held outside Europe, and Director General Cho Shu-ti was elected the new president of the HPH International Network. In addition, Taiwan participated in the European Health Forum Gastein, APEC Health Working Group, and WHA. These efforts show Taiwan has moved closer to becoming a full member of the international health community.
能够当选国际网络理事长，代表台湾结合医疗资源推动健康促进的工作得到国际的肯定。那这也是政府跟民间共同努力的成果，我们感到非常的荣幸跟骄傲。
Over the next 13 years, the population will age dramatically. Faced with this significant challenge, the Bureau of Health Promotion remains committed to establishing an age-friendly environment that lets seniors live independently. An important part of achieving its goal is strengthening the chronic disease prevention system, including pre-disease diagnosis. Examples include waistline and BMI measurements along with screening for hepatitis B and C. These tests allow patients with metabolic disorders and liver diseases to be diagnosed at an earlier stage. For greater effect, such tests are integrated with community cancer screening. The Bureau provides free screening for breast cancer, cervical cancer, colon cancer, and oral cancer. To raise participation rates, 3 steps are used. First, 232 hospitals remind patients of cancer screening in their outpatient services. Then, health units notify those who did not take the screening. And finally, mobile cancer screening is offered in communities. The Bureau subsidized more than 4,120,000 screenings in 2010, successfully diagnosing 33,000 patients with pre-cancer disorders. In the past 3 years, more than 102,000 lives were saved. In 2010, Taiwan's standardized cancer mortality rate was 131.6 per 100,000 people, 8% lower than in 2001. In addition, Taiwan was the only country in the world to provide comprehensive oral cancer screening. Such outstanding achievements mean Taiwan can serve as a model for other countries. Healthy living goes beyond diagnosis and screening. To promote social living among the elderly, the Bureau launched its Health Promotion Plan for Elders. The plan includes annual competitions that bring seniors and communities together. Health of the special groups remains the Bureau's concern over the past 10 years. During the past decade, the Bureau has concentrated on improving maternal care for foreign spouses, treatment of rare disease patients, oral health care for the disabled and for disadvantaged children, and health care for PCB patients. To effectively promote nation's health, BHP had launched the NCD surveillance system to establish evidence-based policies. Also, the online birth notification system had started. The system was recognized by the Council for Economic Planning and Development for its contribution to improving government efficiency.
很多人常常把国民健康局跟健康保险局搞混。其实呢，健保是生病以后再使用的，但是国民健康局的责任，则是要帮助大家少生病、少用健保卡、多健康、多活力。但是以这么少的人力跟经费，要做这么重大的任务，真的是很不容易。但是长期以来，我们的同仁恪尽职责，做得非常的好。在少子化、高龄化与全球化的挑战下，我们的任务更加重大。 期许同仁能够以科学实证为基础，以珍爱生命为动力，以资源与全民的动员为策略，并且与国际接轨，既追求成效的高度，也能够重视公平正义的广度。大家一起来努力，共同促进全民健康。